So I welcome you especially. And we afterwards also have prepared stations where you can be. So we have 2 stations, one over there and one in the back for the online one-on-one interviews. And then for those taking place in the room, it will be here, and we will empty the space for that. And with this, I leave the word to Linde, our Minister for Foreign Affairs.
Thank you. And you're sitting with appropriate distance, that's good. And also, of course, to those of you who join us online. The Swedish corona great deal of attention worldwide, and we are grateful for this opportunity to clarify how we think and how we work. With us here today at our International Press Center is Lena Hallengren, which I guess all of you know, Minister for Health and Social Affairs, and Johan Carlson, which you've also seen at many press conferences, who is the General Director at the Public Health Agency of Sweden. Sweden shares the same goals regarding the COVID-19 outbreak as all other countries, to save life and protect public health. We work with the same challenges as other countries: the scale and speed of the virus, the pressure on the national health system, and we use the same tools as most countries do, promoting social distancing, protecting the vulnerable people and risk groups, and carrying out testing and strengthening our health system to cope with this pandemic. Our Swedish public health response is firmly based on expertise and lessons learned. The decisions by the government are based on the advice from our expert agency and international expert organizations. Measures are regularly being fine-tuned and adjusted to developments on the ground. The government has made legal preparation to be able to quickly implement stricter measures if necessary. Sweden confronts the COVID-19 pandemic through both recommendation and legally binding measures. The government has made a range of decisions that affect the whole society. It is a myth that life goes on as normal in Sweden. Many people stay at home and have stopped traveling. Many businesses are collapsing. Unemployment is expected to rise dramatically. There are a wide range of new regulation and recommendation that affects the whole society, also the private lives of people. There is no full lockdown of Sweden, but many parts of the Swedish society have shut down. Many Swedes are severely affected. And with those opening remarks, I'd like to hand over to our Minister for Health and Social Affairs, Lena Hallengren, and after her, Johan Carlson from the Public Health Agency.
Thank you. The Swedish government has presented a range of different measures to limit the spread of the COVID-19 virus. Our aim is to limit the spread of infection in the country and ensure that health care resources are available. February the 1st, the government decided to include COVID-19 in the Communicable Disease Act in order to provide stronger tools for disease protection and control. Promoting social distancing and protecting older people and other at-risk groups, that has been top priorities in Sweden's effort to stop the spread of COVID-19. Massive information campaigns have aimed to highlight the importance of basic hygiene and social distancing. To protect older citizens, the government has banned visits to care homes for older people. The government has also issued strict recommendations for people aged over 70 to avoid contacts with others and for the whole population to refrain from visiting older people. To promote social distancing, the government has made several changes to the social security system to make it easier to take sick leave, even with the slightest symptoms that could be connected to COVID-19. For example, it's now possible to register sick leave without a doctor's certificate, and the standard deduction for sick pay has been abolished. We're continuing to adapt our social security systems to deal with the outbreak of COVID-19. There is an ongoing work to identify health conditions that put people at greater risk if infected by COVID-19 and to find a system that makes it financially possible for them to remain at home. To reduce the levels of movement of people in society, the government has banned public gatherings of more than 50 people. The government has also taken a decision that there will be only distance and online education for upper secondary schools and higher education. Since yesterday, we do have a new legislation that authorizes the government to decide on certain matters related to combating the pandemic that would otherwise require a decision of the Swedish Parliament beforehand. These mentioned examples are a few of many decisions the Swedish government has taken in order to strengthen our capacity to curb the spread of COVID-19. Lastly, I have noticed there is at times a belief that Sweden has a radically different approach to the virus than other countries. I do not share that belief. Sweden's measures only differ from other countries in two major regards. We're not shutting down schools for younger children or children's care facilities, and we have no regulation that forces citizens to remain in their homes. Since long, we have combined legal requirements with voluntary recommendations in the public health work of Sweden. It has been successful. The national program for vaccination of children is not a legal requirement, and still, 97% of the Swedish children are vaccinated in line with the program. When it comes to the rate of compliance to recommendations connected to COVID-19, it's too early to have exact numbers and the full picture. But we do get encouraging signs in some areas. For example, after calls to refrain from traveling during the Easter holiday, travel bookings to popular holiday destinations in Sweden radically declined. The major operator of travel to Gotland, for example, reported an 85% cancellation rate. When recommendations are not implemented enough, the government is ready to take decisions for stricter measures. An example that illustrates that it is the decision to ban visits to home for elderly care. However, regardless of the legal prohibition to visit these facilities, the high numbers of infected people at the homes for elderly care is a challenge and is one of our major concerns. Lastly, sharing experiences in this global pandemic is important. We can learn from each other. However, since we believe that we need to deal with COVID-19 like a marathon and not a sprint, we are still far away from the goalpost. From the Swedish government, we're happy to share information on our measures and way of dealing with COVID-19, and we will continue to be open, listen to our experts, and we're ready to adjust our own policies if needed. Thank you.
And with that, I give the floor to Johan Carlson, please.
Thank you very much, Madam. Very much has been said by the ministers, but I'd like to summarize a little bit our ideas, our beliefs in this matter. The Swedish strategy is based on two pillars, mainly. The first will be social distancing. General social distancing of people, of course, advising them not to take part in activities together with other people unless you are distancing yourself physically from other people, for example, out in the street, going to restaurants, etc. We have special legislation put in place for restaurants, for sports events, for general events, for how to behave in schools, putting a lot of responsibility on the management of the schools, for example. There is also legislation of maximum of 50 people to be attending an event, for example. But even below that, we have a lot of recommendation how to cope with situations, even if you are fewer people. And we know that these recommendations has been highly appreciated by the public and are followed to a very high extent. There is in the Swedish legislation a a responsibility bestowed on each individual to avoid to spread disease. So it's not that we don't have a legislation in place. There is a bottom line legislation that all citizens need to comply with recommendations and legislation put in place. The second part of the first pillar will be the people at risk and elderly people. We put a limit of 70 years there. I know that some people said 67, others said 65. Based on the good public health in the population, we found that the 70 years is a good age limit to issue recommendations. And of course, the recommendations for those people are self-isolation as much as possible. You should not visit your younger relatives. You should not engage in public life as before, and try to avoid going to the stores, pharmacies, etc. Get help with all those things. And the third and maybe most important part is self-isolation if you have any kinds of symptoms suggestive of coronavirus disease. And that's something also we've seen that about 20% of the workforce is on sick leave, which means that they are really following this. Normally, this time of the year, you know, it's there are flus, there are common colds, there are lots of things that doesn't affect people very much, and they go to work. We see now that people are staying home, following the advice of the agency. The second part, second pillar, will be protecting of the elderly in nursing homes, elderly getting help in their private homes, etc. Visitors have been banned by legislation to nursing homes. There are exceptions, of course, if people are very, very ill and need to be seen by their relatives, but by and large, there are no visitors allowed. We have special guidelines in place since before, but they've been strengthened about how to deal with patients and people living in nursing homes, etc. And I also like to reiterate what the Minister of Health said. Having said this, the difference between the approach in Sweden and in other countries is not very, very big. It's mainly the tone that we deal with the thing. Rather than saying you need to stay at home, you're not allowed to do that and that, we're trying to explain to the population why this should be done and the reason for it, and also the rationale for doing certain things. For example, we are not telling people to stay indoors. I think that's a very important part of our policy. On the contrary, people should go out, exercise, get fresh air. It's good for the physical and mental health. To stay indoors, listening to radio casts announcing that you're not allowed to go out, I can't see any rationale in that unless you're immediately hugging your neighbors when you go out. Especially people, elderly people that could go out on their own should do that to really strengthen their health in the long run. We have not closed the lower grades of schools. We haven't seen any reports, any evidence that should be an important part of the policy in this field. There are so far no reports from China nor other countries that this is a major vehicle for transmitting the disease. On the contrary, there are a lot of negative effects on closing the schools. We know that a lot of children come from unsafe homes. They don't have anything to do. They are scared to be out of school. We know that it's important for children to have a point where they could meet, where they could talk to the teacher, etc., etc. So balancing this very vague evidence that this should be a good means for stopping the disease, balancing that to the negative part, we found that having the schools, the lower grades open, it's important for the long-term health of the population. As I said, we're not locked in people. We've got reports from other countries, and you've probably read it yourself, a lot of violence in homes, a lot of alcohol and drug abuse when people are locked in. And I think that's a very important part, because when we come to the end of this episode, this pandemic, which will be in a few years' time, it will not be this summer, it will be much longer time. We need to look at what was done. What's the long-term effect of the health of the population? Not only those people suffering from disease today or even dying from the disease today, what will be the long-term effect of this? Do we think that our measures are good enough? Do they work? Yes, we've been watching or been surveying data telling us that it works. The social distancing works on other diseases that we could measure. For example, the influenza epidemic that we have every year, and we're following it very closely with sentinel studies. It died out in 7 to 10 days after the social distancing was put in place. Also, the calicivirus, Norwalk virus, disappeared almost totally, which we've never seen before over the 5-10 years we've been following it this closely. We're also following movements now. We are putting in place a system where we could follow movements through the telephone system, not seeing individuals, but seeing the general pattern. We see also, as you could, those of you who are here in Stockholm today, see that it's the movements are very, very scarce in this part of the country and in all parts of the country, if you compare to 2-3 months ago. So we actually think it's a policy that we could live with. And that's my fourth part. We need to have a sustainable policy. We could live with this policy for a long time. We don't have to change policy, sort of exit these things in a few weeks, in a few months even. We see from other countries that now they are looking for exit policy. How should you open up society? Our policies are sustainable in that respect, that they depend a little bit on the situation. We have guidelines, regulation in place where we could adjust according to what is needed for the area, etc. And they could be in place for a long time. I'll say something about comparison between other countries, because since you are here. I think it should be said that it's very difficult. There are no clear correlation between the lockdown measures taken in countries and the effect on the pandemic. We can see countries where great lockdowns with very high spread, high mortality. Other countries are less affected with the same lockdown measures taken, if you compare neighboring countries all over Europe. So I will refrain from doing these kind of comparison at this time. We need to follow the situation. No country would know the spread of the disease in the country, because there's still no good methods for measuring this. We don't have serological methods. We need to have that, and they are underway. When they come, we could measure how is the spread in various countries. What are the special features of this disease? We know that this is not influenza. It's not spreading all over like a homogeneous wave of disease. It's very patchy. We saw the Italian situation, for example. They were surprised. We were all surprised by the appearance of the disease in northern Italy. We see this in other parts of the world. We saw this in South Korea. And we've probably seen it. It happened in many parts of Europe to a smaller degree. And that would describe very much the situation in various countries. In this country, we have an outbreak in this part of the country, the Stockholm area, and a few other regions. The rest of the country is very low prevalence of the disease yet. And this goes for all countries. So I will wait with a summary of what is happening until we know more about the spread of the disease, about the immunity, about what will happen in the next and second and the third wave. We are not there yet. I think I am that. Thank you.
Okay, thank you. And with that, I think we'll start the questions. And for you joining online, remember to raise your hand, and as I will ask you to do in the room as well. No, oh, David. Yes, from AP.
Thank you. We've seen Anders Tegnell mention the possibility of herd immunity appearing already in the Stockholm area by May, and he was mentioning this in the Norwegian media. What exactly does this mean at this stage, given that the CDC and the WHO have mentioned that the whole idea of herd immunity is still very untested and there's so many unknowns? So I understand that the strategy is not herd immunity per se, but we're now hearing that this might be attained by May. Is this the case, and what exactly is meant by that?
The answer is that we don't know yet. It was mentioned in one of those predictions made, sort of theoretical models made, but to be honest, nobody would know, and we would know very little about the immunity as such on this coronavirus. I mean, the answer is it's yet to be seen.
But May is the date. This is when you expect herd immunity in Stockholm?
According to this prediction, but I would rather say let's wait and see what happens. We still have not got any good methods to measure neither antibodies nor immunity as such. So let's wait for that.
Okay, and then we have one question from Austrian television online.
I have a question to Lena, actually, too. The first one is Sweden's strategy from the beginning was to keep public life going, but to protect the elderly people. But now there are many corona infections in elderly homes, and 1/3 of the deaths are coming from there. Who pays to protect these elderly people?
What's the question?
Can you
Sorry.
repeat the last question?
We didn't hear.
What's the question?
The question is who failed to protect the elderly people? How could it happen that the coronavirus came so many elderly homes?
To start with the fact that we didn't start the strategy by saying that life should go on as before, but we adapted different measures as in the same time as we could see the spread of the virus. And you're absolutely right. We mentioned it before that the most important has been to protect the vulnerable group and the risk group, and mainly the elder people. As far as I know, that is a problem for many countries, and I agree with the fact that this is something, as I mentioned before, something which is our biggest and deepest concern, how to prevent that from happening even more. I think it's too early to say why did we have that infection spread in our elder care centers and homes. We don't really know. We have many elder care homes within Sweden run by the municipalities and many other heads for the elder care homes. We're trying to investigate that actually in Stockholm right now together with a public agency to really try to know more about how could it happen and how could we prevent it from happening in other parts of the country. So I think that's the answer for the moment.
Yes, but Minister, in Austria we have around 400 deaths, and in Sweden we have 3 times more. And don't you think you responded too late? Shouldn't you have tested the people that work in elderly homes much earlier? It was your strategy to say you protect the older people first, but that obviously didn't happen.
I think it's too early to evaluate that really for Sweden, and to be honest, even in other countries, we're in the beginning of this pandemic, so I think it's too early to say. But it is a fact that we have banned visits at the elder care homes. That has been a recommendation for, I think, more than a month, 5 weeks or something, and it has been banned. It's legally forbidden to visit your elder relatives at the elder care homes. But I think this. Yeah.
The Swedish radio reports today that many chiefs at the elder care don't even test the employees because they say they are maybe
And I don't agree with you saying that it's time to evaluate who has succeeded in their fight against the virus at the elder care homes or not. But as I said before in my presentation, it is of the deepest concern to make sure that we know how could it happen. Is it due to lack of personal protection equipment, or is it because we have professional and staffs visiting with slight symptoms? Did we have visitors, relatives? Have the elder one been apart in society for too long time? We don't really know the reason why, but I would say, and Johan Carlson might be completing a bit of what I'm saying, but we have a situation where we're having really trying to have the best possible statistics to really know what's happening, try to follow both the spread of the virus, but also the cause of death. But I firmly believe that it is too early to evaluate, and I think it's too early also to compare countries in this very specific matter, because statistics is different also between countries. But if you want to,
I think we should realize that the outbreak in this country is very localized here, and I agree with you. There was a shortage at one time in testing capacity that it was concentrated to the hospital, which is very, very important, of course, to the hospital staff, etc. We are scaling up that. We have been scaling up that for a long time, but yes, you're right. I mean, the preparations in some of the nursing homes were probably not enough for this kind of pandemic. But I think we share that with many, many countries. And as I said before, this is not over yet. We need to realize everywhere in Europe that this pandemic will continue, whatever we do. The idea is it's mitigation. And if we have seen problems in the first phase, we need to fill in the gaps. We need to tighten it up when it spreads over the country and when it comes to other countries. It's utmost important.
No, thank you. We need to move on, Nikolai. Thank you. We are so many having questions. So we will go to German television and then to New York Times.
Ja, Randi Häusler, ARD, tysk TV. Socialministern, 22 forskare kräver en kursändring från regeringen eftersom de fruktar italienska förhållanden här i Sverige. Vad svarar du dem?
Sverige har ju en strategi och ett sätt att arbeta som utgår både från att vi tittar naturligtvis och följer de expertmyndigheter som finns, och det inkluderar också internationell data som vi har tillgång till. Det handlar om att hela tiden vidta åtgärder för att skydda riskgrupper, för att se till att vi har åtgärder som också kan både ha en stor tillit hos befolkningen, men som också kan finnas kvar över tid, som också nämndes här tidigare. Vi ser ingen anledning att ändra på den inriktningen, och med all respekt för 22 forskare så är det ändå så att i Sverige har vi en öppen diskussion. Det finns möjlighet för den som inte delar uppfattningen som är den rådande att få uttrycka den, men det ger inte skäl för regeringen att ändra uppfattning och ståndpunkt.
Tack. Då går vi till New York.
Boel, jag vill att Johan säger
Yeah, sorry.
Maybe I should make a comment in English anyway because of the people.
Awesome.
It's about this article of a number of researchers wanting us to change the policy. Yes, I mean there are very few. Have you seen any issue that will unite the scientific community totally? No. The second is that this article was based on totally false premises. I mean, they backed it off themselves the same day, saying, yes, we misinterpreted figures when they predicted the Italian situation. Having said that, yes, we could have differences in opinion, but I think we are very firm on our policy and following the situation. So it hasn't changed our policy, this specific article. We have a very large part of the scientific community supporting us and also working with us in the Public Health Agency. Many of the major scientific workers in this field are in the group where we are trying to line out the policies.
Okay, thank you. And then we will move on to New York Times.
So my question is for Ms. Hallengren. What are the recommendations in terms of protective gear and safety protocols for nursing homes and home health care, like for the country?
Sorry, for
protective gear?
I don't know if it's for me to answer the question really, because all the kind of recommendation of what kind of equipment you should use when you're working in the healthcare sector with the elder care or in any other situation where you can have contact with the disease, that is something to follow by the recommendations. They're made by the National Health Agency, and of course they are aligned out of the knowledge we have so far. So in both the healthcare sector and the elder care sector, it's important to have the right equipment at the right time, and that is something really to work with, but out of the guidelines and recommendations.
We have, as the Minister said, we have a very risk-based approach on this, and the basis is the basic hygienic standards that we need to have. We have not yet advised on masks, protective gears for general care of people in their homes, unless you have to deal with people with symptoms, of course. And the mainstay of the whole policy is, of course, that people, staff with any kinds of symptoms should not work at all, regardless of the basic principles. So, I mean, we have a basic principle saying you're not working either with elderly or anyone else if you have symptoms. You have the basic hygiene standards to approach, and of course, if you're dealing with patients, with infected patients, there is a risk-based approach for various gears when you come closer, what kind of things you are doing with them, of course.
Okay, then we have Finnish television, MT3.
Yeah, question to Mr. Carlson. So far, situation is quite stable, but what about if the situation goes worse? Do you have some kind of roadmap what you are going to do? Do you think that it's possible to get more restrictions? Is it possible that Sweden is going to do same kind of close down as what we have seen in another European countries?
Of course, there is a toolbox for everything, and I'm not going to speculate what we could do, but there are legislation in place, of course, and either under the Communicable Disease Act, there are still things to be done. Especially if you get very localized outbreaks in cities or communities like that, and also if we get a situation spreading all over the country where, for example, transports and movements of people would be the major vehicle for that. So, I mean, there are things, I don't like to speculate what could be done, because that would be cited very, very quickly of being something that we are planning. But yes, there is a toolbox. I think there is in all countries. But what we're seeing now, as I said, we have measures put in place that we think are sustainable. Are we not thinking about easing up those things that's happening in other countries? We are staying with the things. They could be adjusted to certain, depending on the situation. But so far, we think we're fine with the situation as it is now.
Okay, David from Haaretz.
David from Israeli daily Haaretz. I have two questions. One for Mr. Carlson. What exactly is Sweden's testing policy now when it comes to testing the general population, to have a good image of what the rate of infection is in the general community? And second, for Foreign Minister Linde, you said last time you were here that you're trying to get Swedish nationals back from other countries and that a lot of effort is being put into that. I'm wondering if someone in the Foreign Ministry is taking a look at the parts of the world which I would say are a bit darker, where no so much information is coming from. I'm thinking of places like Xinjiang and the Uyghur population there in the camps, or Myanmar, where the Rohingya people live, places like that. Is someone in Sweden's foreign ministry taking a look at that and adjusting policy to those places with conflict and civil wars and so on?
Should I start? Okay, sorry. Yes, we have been, as I said, we have been scaling up the testing policies over the last 2 weeks. And now today we will put in place a more comprehensive strategy, still based on virus identification. We still think it's too early to base policies on serological tests, that the immunity test. There's still methodological problems. I haven't seen any really valid studies done, but it's underway. The priority will, of course, be patients with symptoms, patients in hospitals, risk groups, and people elderly at nursing homes and institutions. Secondly, staff dealing with these patients. That will be the two groups that we will be covering very quickly or under the upscale. The third will be staff in important areas of importance for the society. I think about, for example, staff in nuclear power plants, police, you know what I mean, all kinds of specific groups that we need. And fourthly, it will be the general population, but then we talk more about when we come to the serological tests at a later stage. We're also conducting now, since last week, studies. We have a study that we discussed yesterday at our press conference from Stockholm, as you probably saw, and we are doing a similar one all over the country. We have in place since many years cohorts at the Public Health Agency. They are very well-known cohorts where we know their status, know everything about them almost, and they are now voluntarily being tested all over the country. So we are looking at that. Then there are other initiatives from universities, etc., also dealing with this kind of testing. But we are, of course, as everybody else, very eager to get in our hands a good serological test to see really what was the spread in certain areas. We're also looking at different groups in the population groups, of course, which is important, not only age groups, but also ethnic groups. We know, as has been reported from other countries, that the spread in certain groups, in certain areas, socioeconomic groups, ethnic groups, are worrying to some extent.
If I should say a few words about this when it comes to taking home Swedes from abroad. So far we have taken about 4,900 Swedes back to Sweden with assistance from the Foreign Ministry, with about 130 different flights. We think there is still 4,500 people who have said that they want help to come home, but it's more difficult as every day passes because of lockdowns and restrictions and so forth. We have a daily update on the situation globally and in different countries about the spread of the virus, but we don't have a specific, I think that's what you meant, if we are not going to help people from specifically infected areas or so. Yeah, generally, we have a daily update that I get every day, well, everybody else who works with it get this every day to check where is the virus, where are they on the curve, and so on and so forth. So we try to follow it very, very closely. Thank you.
Okay, thank you. Then I think we should let BBC join online.
Hi, I'm actually participating as a freelancer today. You talked about, this is for Johan Carlson, how we don't know yet about herd immunity. There is no vaccine, and all of the messages we've had have been that these are measures to last for months, not weeks. What would need to happen for the current recommendations and guidelines to be relaxed? When could people start living a slightly more normal life and perhaps travelling again?
I think it's too early to say. I mean, I would hopefully, before the summer holidays coming, we can see a more relaxed situation, but I can't promise that. Nobody else could promise that. But as I said, I think our recommendations are sustainable in that respect, that people are allowed to go out. I mean, I'm more worrying for countries and areas where people are locked in. How should you cope with that if the situation isn't getting much better? We have a situation where you could allow people out, you could travel in the local area, you could cope with this situation, and if worst comes to worst, we need to live with this over the summer also. But I'm not so.
That's a very different time frame to some experts who've suggested social distancing measures might need to be in place as far in the future as 2022. One study suggests.
Yes, of course. As I said, I'm not talking about lifting all the measures, but if we can ease up some of the things. Not before the summer. I also agree that since we have it, for us it's easier to let them be in place this year and also next year, but it wouldn't have been that if we locked in people, really. And I think it's more difficult to go from a total lockdown to an open situation, because we've been trying to tell people these are the measures necessary. They will understand that it's necessary. They will comply with the measures, and they will even like the measures because they see it works. And that's the reason why we could live with this for a long time. I see the problems, the discussions going on I tried to read the papers in at least the language that I could read, like French and German, just to follow what is happening. And there's a lot of discussion, how could we open up, and what should be done, etc. We are not in that situation. We can live with that. Of course, we need to discuss what will happen to universities and upper secondary schools in the long run. But apart from that, we could live with this for a long time, even until 2022 if necessary.
And as the Prime Minister said as late as yesterday, there are no plans to lift any of the restrictions yet and now, and I think that's a very important message to send to you and, of course, to all Swedes, that the situation we're having is not changing right now or in the near future. So be prepared to keep the restrictions for a time.
And I can chip in that the Foreign Ministry has a recommendation not to travel anywhere in the world until the 15th of June, and then we will take a new recommendation after that. But we have said that we don't think it will be possible even after 15th of June to totally travel. We think that in most countries it will still be extremely difficult.
Thank you. Now we'll go to Finnish television, Yle.
Hello. When it comes to lifting restrictions, even if it's not likely at the moment, which ones would you prioritize? Which ones are the ones that will be lifted, will likely be lifted first, and which ones are the ones that you need to live with a longer time?
I think maybe it's for the
It's short reflection. I would guess what we're looking at, as I said, we're looking at the school situation. I mean, as we said before, we don't think closing the schools is a major instrument for this. I mean, the shorter time we could have a school closed down, the better. Since we haven't closed the lower grades, but it's still the upper secondary grade, and so I'm not quite sure we could do that this semester. But I mean, this is something we're looking at. What will be the impact of that, etc. The other thing, when it comes to restaurants, to public transport, etc., we couldn't live with that for a long time. That's not a major thing. And since we haven't closed down shops and restaurants, this could be sort of something that the people need to assess if they like to go out, given that there are restrictions, how to be seated and etc. That will be automatically adjusted according to the situation, I would say.
And correct me if I'm wrong, but the social distance is the most important to keep, and that is, of course, in all the places and times of the daily life.
Okay, so we'll have two short follow-up questions from New York Times and AP. Is that correct?
My question goes back to the protective gear for home health care and nursing homes. Wouldn't it make sense to very, very early on have just said, we need more protective gear, or you must use protective gear, since you want to protect the vulnerable population?
I would say it's not that easy, because, I mean, if you have protective gear, you also need to know how to use them. A lot of problems with protective gear, if you have the problem in nursing home, especially home health care, that are very untrained staff, and that will be in all countries. I mean, people come and go, and that's one of the problems we have. There are many individuals seeing each elderly, for example. We know that it could be over a week, maybe 10 or 15 different people coming and going, and to rely entirely on protective gear, we think that it gives you a false safety, reason of safety. To have social distance, even if you go to people's home, if you had basic hygiene methods, for example, unless the elderly himself or herself have symptoms, of course, you need to protect yourself. This is mainly for protecting the person. To comply with the general hygienic standards, you will come very long with that. And it has been shown very, very often that saying that you should wear protective gear if you're not a trained person doesn't add very much to that.
Okay, thank you. And one last question from the floor, AP. Quick one.
Yes, thank you. I would like to, for the Foreign Minister, please. In February, in the opinion piece, about the so-called Frugal Four, Sweden called for permanent net corrections to the contributions to the EU budget, with now Britain leaving the EU. With the European Commission President touting this next budget that we're coming into as a coronavirus Marshall Plan, does Sweden still plan to be frugal in the 2021-2027 EU budget?
Well, of course, there will be discussions when you discuss the EU budget according to what has happened with the virus. But we still have a very, I would say, clear view when it comes to effectiveness and how big we want the budget to be. Not the least because of Brexit, there has been a reduction in the incoming means for EU, and we think that we have to correct the budget accordingly. When we don't have the influx of money from Britain, we have to reduce the budget, and we have to change what we use the budget for. And I think that there has to be made, of course, prioritization inside the budget, but it doesn't mean that the budget needs to be higher.
So no solidarity for coronavirus?
The prioritization of what you're using the money for needs, of course, to be discussed. And we want to have more money, for example, to the WHO. We want more countries to have development cooperation aid. We have 1% in Sweden. Nearly no other country has it, because we think that that is being also used in countries that is severely affected by the virus. We hope that more countries would put money on that. But when it comes to the EU, we still have a rather strict view on how much we should have in our common budget.
Okay, thank you so much. And now we will go to one-on-one interviews, and my colleagues will we will help you to organize where you will be. Thank you.
Du vet att det är 10 minuter. De ska ha nästa. Och jag har också 10 minuter. Ja. Vad sa du?
Did you get my letter? Did you get the letters I sent you? Yeah. No, I didn't. Okay, I didn't see that. But I got so many emails. So the only one, I have more, but those are the one I found. I think you're on the